My name is Robert Minutello. I'm an interventional cardiologist at New-York-Presbyterian Hospital, Weill Cornell Medical Center. At New-York-Presbyterian Hospital, we have a number of clinical trials that we participate in, which affords us the opportunity to offer to patients who have conditions, structural heart conditions, valvular heart conditions, that are not amenable to standard techniques. And in this way, patients could potentially undergo life-saving and life-altering procedures that they may not otherwise have access to. But much has happened in the last decade. The indications for transcatheter valvular implantation have broadened. In addition, we have a number of new devices, not just for treating patients with aortic stenosis, but treating patients with other structural heart problems, such as mitral valve disease, and other diseases which affect different chambers of the heart. I believe it's important that when a patient chooses an institution, they choose not just a single physician, a single interventionalist, or a single surgeon. They have to choose the entire team, because that team as a whole, as a multidisciplinary unit, will be providing the care for that patient. We at New York-Presbyterian take great pride in our team and the different components of the team. And in doing so, we can provide the best care for our patients. We have an armamentarium of nurses and nurse practitioners, as well as cardiac anesthesiologists, echocardiographers, and CT physicians, in addition to interventional cardiologists and CT surgeons that provide the best care for patients with valvular heart disease. What distinguishes us from different institutions across the country is our approach to a patient with structural and valvular heart disease. We believe that the treatment of a patient with structural and valvular heart disease does not only involve one physician or two physicians, but a whole team of physicians and a whole team of healthcare practitioners. And in this way, we're able to provide the best care for our patients. So our structural and valvular heart center has been around for approximately 1 decade. When we first opened it up, we were treating patients mainly for aortic stenosis who were not otherwise eligible for open heart surgery. For the last 21 years, I've been a physician at New York-Presbyterian, and I've been fortunate that NYP has allowed me to treat patients the way I believe a patient should be treated, the way I would want to be treated, and the way I would want my family to be treated. We are a large institution. We have depth within our facilities. But in addition, we do put patients first. Our fundamental priority is patient experience, patient care, and we do everything in our power, and I do everything in my power to make sure not just the outcomes are the best possible, but also the patient experience is the best possible.